Welcome everyone. I think we're really thrilled to have you all with us this evening. Thank you so much for spending your time with us. I'm unbelievably pleased that the 5 members of the panel have all agreed to be part of this event, and I can't wait to hear what they have to say. So I'm going to introduce them all as they speak, and then after the break I'll be putting some questions to them. Okay, and so we're going to start by mutual agreement with Tamara-Jade. Thank you very much for being brave enough to go first. Speaks to your excellence already. Tamara-Jade Kaz is a creative facilitator and trainer based in London. She enjoys facilitating spaces that embrace conflict, emotion and personal experience and harness it into social action, and has worked in this field for over 6 years. So she also works as an illustrator and visual note taker. You can find her work on her website, which Courtney will share at the end of the event. And I can attest that it's really stunning and very visually rich. So I'm going to hand over to Tamara-Jade now. Thank you.
Thank you. It's so nice to be introduced in that way. Hi, yeah, I'm Tamara-Jade, and I guess to kind of really address the topic, like I am a dyke. I would describe myself as, yeah, a cis dyke. My pronouns are she, her, and yeah, I have mental health problems. Woo! And I've self-harmed, so that's why I'm on this panel. And so but because of this panel, I was like, oh, how do I start talking about this? How do I not just go down a hole of just talking about various things that I've done to myself at different points and then just get stuck? And then I thought about the kind of inverse of self-harm. And so I've been thinking a lot recently in my work, like Veronica said, I'm a facilitator and trainer, and I usually work with people who want to do some social good. And so a lot of those conversations that naturally come up is, how can we take care of ourselves? And so I've been thinking a lot about self-care recently, and how like it's everywhere and everyone's talking about, oh, you need to take care of yourself, rah, rah, rah. And like, I guess I ran a session recently and it made me think like how individualized self-care has become, and how I guess against the context that we're in, like a very neoliberal kind of society, there's this idea that like it feels like self-care has become this thing where like it's your personal failing if you haven't been able to take care of yourself, and you're the only one who's like responsible for making sure that you take care of yourself. And I've like started my sessions now because I've tried, me and like Nim works with me, Nim and I like have tried so many times to think about how we can do a self-care session without it kind of going down this path of thinking about our own individual failings. And like, it seems that the world is saying, oh, that what we need to be doing is buying ourselves something, the old bubble bath type thing, to kind of manage the very real pain we're going through as LGBTQ people. And I guess like, even more so in this pandemic, we're feeling like we want to be in control. And so for me, I see like buying a candle, and the times that I've harmed myself, which started for me when I was a teen and has been on and off since. Like, I think what it is for me is you're trying to find control against a backdrop of society that's like completely at odds with your survival. And I feel like in those moments, it's a short, buying something or harming myself is a very momentary kind of way of feeling like this is like a feeling control. And I've been trying to think of new ways of thinking about, okay, what are the more healthy ways that doesn't rely on the exploitation of so many people, that I can be managing my desire sometimes to harm myself. And I think, as I say this all the time, like I feel like self-care should always be rooted and connected to something bigger than you, because that's something that's sustainable. So at boot camp, which is one of the places where I do my work as a trainer and facilitator, we have a ground rule for anyone who comes on our trainings, and it's take care of your needs so you can show up for the group. And I think our society wants us to focus in on take care of your needs. But I think the part that has helped me survive the pandemic has been so you can show up for the group. And so I think the ways, some of the issues I've been having that's been making me miserable has been loss of work, housing. I almost got evicted last year, annoying. I'm fine now. And there's been all this time to think about family. And then another issue I've been having as well personally, and I'm sure lots of queer people would identify with this, is that the governmental response to like how we're meant to be keeping ourselves safe has kind of artificially injected this idea that we need to be living these heteronormative lifestyles where we have like this one partner, and we've, I don't know, I've been pushed into some relationships where I was just like, I'm doing a very straight thing here and I didn't sign up for this. And so I feel like some of the best responses I can have, I'm still working on the love life one, like I don't really want to be just seeing one person, I'll be honest, but that one, maybe you can answer that for me, somebody else can answer how to manage the heteronormativity. But I feel like there's so many ways collectively we're taking care of each other that gives me hope. So when I almost got evicted last year, there's an organization called London Renters Union that I support and I donate to every month. And they helped make sure that I didn't get evicted. And so it's not just down to me, like what felt like an individual problem of, oh, I'm going to lose my housing. The solution is in the community. And so I've really, in the pandemic, been focusing on how I can connect to my chosen family. And that, I'm just going to shout them out. Nim, who's on this panel, is my chosen family. Like, they are my sibling, they are my person. And so I feel like really grateful to be able to connect in with other people and think about what other ways can family protect me from harm. And then obviously we've seen a rise in mutual aid, which has been incredible. And there's groups out there like Swarm, which is, I think it's sex workers, what does it stand for? Sex workers resistance, something resistance movement. It's a sex worker group. And they have been doing some incredible mutual aid work because lots of sex workers have lost money throughout the pandemic. And they've done some great work of redistributing funds amongst various sex workers so they could survive financially. So there's just so much stuff that makes me feel better when I have these things that feels like a personal failing and an individual thing, that actually there are ways out through, I guess, connecting to others. And yeah, oh, I'm also an artist. I didn't talk about that. Sometimes I do art too. That's it. I think that's my time.
Oh, that's so brilliant. Thank you so much, Tamara-Jade. What a perfect, joyous way to start our event. It couldn't have been better. Thank you so much. I think what you talked about collective care is something that we believe in so strongly. I think that's the most wonderful and insightful way of thinking through the questions that we're raising in this event. That was really wonderful to hear about. Thank you so much. And I look forward to hearing more of your thoughts in the Q&A. And we're now going to go to Ginny Russell. I hope Ginny is who's expecting to speak next. If not, I've made a horrible error. Ginny is an interdisciplinary senior lecturer in mental health at the University of Exeter. Her research interests encompass autism, ADHD, and self-harm, and problems of medical and binary categorization. And I recently read a really excellent article that she wrote on selective public and patient involvement, which makes me particularly pleased that you could be with us this evening, Ginny. So thank you so much. And if you are expecting to speak next, please do speak now.
I am, and thank you so much for having me, guys. And I'm really glad I'm the old person on the panel. That feels really, I feel really happy about that. Yeah, So yes, I'm an academic researcher, so I've got a slightly different perspective. And thanks to Tamara-Jade for that really very powerful and really fantastic start to the evening. I really enjoyed hearing you speak. So I'm looking forward to hearing more from you later. So my work's in epidemiology and qualitative research, but before I was an academic, I was a TV producer, director working at the BBC and other places. And before that, even, I was a self-harming adolescent and young woman of nebulous, uncertain gender. And ironically, it was the pram, which is the great enemy of creativity, as we all know, that, in other words, having kids, that made me more comfortable that I was definitely a female. So yeah, that was my history. So I can talk from all of those perspectives, and I'd really be interested to hear if what I have to say resonates or not. And many, many thanks to Courtney, especially for the invite. I've got a lot of respect for Makespace folk and Courtney in particular, and the understanding that stopping self-harm is not necessarily the aim. So I've sat in a lot of medical style talks about self-harm, psychiatry talks that I've attended, and they tend to view self-harm as a terrible problem, and the aim is to kind of stop people doing it. But we could instead perhaps try and work from a different perspective, a neurodiversity perspective, or with a model that repositions self-harm so that people self-harm when they're distressed or they're suffering emotional overload or dissociation, and self-harm is actually a release from that. So this repositions self-harm as a way of coping with emotional distress or dissociation. Therefore, it makes little sense to try and suppress self-harm. And I'm sort of talking from really, this isn't my area, self-harm, but this is more kind of what I've picked up through the research I've done over the years on stimming, which is repetitive movements. And I think there are quite a lot of parallels between self-harm and those sorts of behaviours. So there's just a few facts from an epidemiological and research perspective. First, self-harm is more prevalent in girls than boys, far more prevalent. Also, self-harm is more prevalent in people who identify as part of the LGBTQ plus community, and that's something we could maybe touch on. Also, it's very much associated with age. It peaks in adolescence. There are some people, but far less, that self-harm later into adulthood. And it's also more prevalent in neurodiverse groups, so people with autism and ADHD, than non-neurodiverse people. So I think what we need to ask, one of the questions we need to ask is why? Why is that? And it seems to me that all of these groups, girls, queer folk, neurodiverse individuals, often share a sense of being othered. And indeed, they are all tangibly discriminated against in very real ways. And we can easily find the statistics to back this up. So I kind of wonder if that not fitting in to societal expectation, that kind of lack of acceptance from society and discrimination contributes to the emotional disconnect associated with self-harm, hence the higher prevalence in these groups. Plus, there might be some cultural conditioning as well to certainly in girls, to turn anger, misery, despair, frustration and disassociation onto oneself. Whereas boys are more likely to act out aggressively, take this out on those around them. There's what we call externalizing behaviors in child mental health, which boys are they're much more prevalent in boys, and disorders of anger and aggression. And so there's a big gender contrast. And I think that might be related to the gender constraints of how one is expected to act and what is acceptable. So yeah, so for me, I can only really speak personally. I'm interested in the idea that the aim is not suppressing self-harm, but maybe acceptance of difference and promotion of diversity and understanding. And therefore attempts to suppress self-harm are not really very helpful, but I haven't got any experience with services. And I'd be really interested to hear people's experience of CAMHS in particular, because there always seems to be a call for more mental health services, which we hear frequently, but that kind of presupposes those services are helpful. So yeah, I think I'll leave it there.
Thank you so much, Ginny. I feel like that raises so many interesting, complex it's in some ways the perfect talk because it raises 100 more questions that I think we all want to be thinking about and wondering about. And I certainly think it's one of the things you touched on that is really interesting to me is this question of how sort of certain behaviours and practices are gendered. And it just really reminded me of something that came up a lot in the research I did, that I talked to a lot of people who talked actually with a lot of concern or care about the ways in which actually perhaps behaviours that are less typically seen as self-harm, but because of their association with like more externally facing aggression or something like that, actually really function in a similar way. And so that actually there's a question of who gets missed and whose experiences are understood as self-harm, and how that really like coalesces around questions of gender and race and sexuality that seems really like important and interesting. So thank you. I feel like you've raised so many interesting, important things, and I can't wait to be talking about them more in the Q&A. I'm going to move on and introduce Raihan, who I hope is also who is expecting to speak next. And I expect people to just interrupt me if I'm introducing people in the wrong order. Raihan is the group facilitator for Hearts and Minds' queer and trans space. They're a multidisciplinary worker in peer support, graphic designer, and consultant regarding ethics and relationships in community organizations. They think through the frameworks of psychology, critical race theory, transfeminism, abolition, and grief positivity. And I was saying to Courtney earlier that when I read that list of interests and expertise, I couldn't have thought of something that more perfectly encapsulates a group of interests that seems really vital and wonderful. So it made me very excited to hear from you, Raihan. Hearts and Minds is an organisation we really love at Makespace, and we're really excited that Raihan could join us today. So I'm going to hand over to you now.
Hello, thank you for that lovely introduction. Yeah, I've already affirmed by that, so that's really nice of you. Just kind of for reference, I'm going to preface this. I'm going to look down a lot because I've got notes, and I'm going to give off very kind of like the worst person at the stand-up on like Drag Race kind of vibes by looking at my notes, but it is what it is. So I also wanted to thank Ginny and Tamara-Jade, and specifically kind of praise and re-emphasize what Tamara-Jade said in terms of us needing to kind of relocate responsibility from self-care to community care, because I think that is kind of the most vital intervention we can make, because essentially people who are self-harming are suffering deeply, do you know what I mean? And there's only so much you can do in the way of kind of pastoral and restorative and kind of palliative care. And the most important thing to do is to create the conditions for people to thrive, feel safe in, you know, go to sleep at night feeling safe in their body and their home and their city and their world. What I'm going to speak on is more of my personal kind of trajectory, because I guess I'm talking about the kind of pastoral and like palliative parts of it. And it's essentially what I'm interested in is the relationship between self-harm and kind of violent dislocation from the body. Because for me, I mean, I've met a lot of people who self-harm. I used to be a big cutter, very famously cutting up the place. Sorry, that's such a crude joke. I mean, yeah, drinker, user of many things. Yeah, lover to many as well. But I think that the thing with me is all the people that I've met who self-harm as well seem to have two things in common. I mean, there has been a few kind of straight people, cis straight people, but I think by and large, there seems to be a lot of queer people who have had adverse childhood environments that they're responding to. So for me, it was growing up in a situation that was quite acutely dangerous. There was just a lot of kind of chaos and hectic energy in my house. And I grew up, I mean, I didn't actually really realize this. You know, I'm going to give a content warning. I'm going to talk about sexual abuse. So if anyone needs to leave, pause, that's absolutely fine. Please take that time for yourself. So it was confirmed for me about a year ago that I was sexually abused by several members of my family when I was younger. I'd always like suspected it, but everyone was like, "No, you're crazy." I was like, "Oh, okay, I'm crazy." Sure. But what was happening led to this violent dislocation, and it was a constant, repetitive, violent dislocation from my body, wherein I began to feel unsafe. I didn't feel like I belonged to myself. I was also kind of the subject of quite needy parents. So there was just this whole thing of not belonging to myself. And then you add to that growing up being queer. I mean, it's just like, oh, well, I don't belong to myself. I belong to the world. I belong to the streets. I belong to your perception of things. So for me, what it has become about is making an intervention at the level of the body. Because I first started cutting when I was like 8 years old. I saw like Lisa from Hollyoaks doing it. I was like, that is so true. Like whatever she's experiencing, like I feel that. Like, so I did that. And what I was really doing it for, I mean, I know this is kind of stigmatized, but I think I really was doing it for attention. And it's absolutely fine to want attention. It's actually really important to, well, you know, we all do want attention. It's necessary to respond to that need. And what I wasn't getting that. And I think that if I was being cared for and that was being attended to, I mean, all of my emotions and needs, the good ones and the negative ones, I would have probably been a lot better off. I felt a lot safer. So instead, what happened is that those needs were neglected, and then I learned to neglect them. And then tying into that was shame, which became kind of a regulating and persistent theme. I think it's the theme of a lot of people who are non-straight and non-cis. I think it's something that particularly kind of pervades the UK. I don't know, you know how we will have that kind of like stiff upper lip thing, can't talk too much, have to be kind of self-deprecating, like very anti-LA kind of vibes. So I think all of that, once that happens, it creates like a habitus, and habitus is an anthropological term for the way you internalize kind of societal structures, is this recession into the body and this constant living in fear. So for me, what has happened was that I had to realize what I was doing was trying to take up as little space as possible, but make maximum impact. So I was going out and I was drinking as much as I could because there was a lot of anger and shame and all of this stuff, but I wanted to bring it in on myself. I didn't want anyone else to see it. I was, you know, in the little space that was on I'm 5'3", you can't tell, but my arms are tiny. I was, you know, I was doing masterpieces with braces on my arms because it was about that receding and that keeping myself to myself, but making maximum impact. So for me, the alternative, and I think this can be before and after, is engaging with your body. And it can be things like body modification. It can be dyeing your hair every second. It can be throwing it back when you're in the club. It can be dressing as ostentatiously as you want. You know, things that are really kind of antithetical and healing for shame. So for me, yeah, I guess that's what it is. And that's where I'm at with it. And what I'm working on personally is, you know, saying no to things like drugs, sex, and 2 years abstinent. Yeah, it's you clap, Veronica, you clap, but it's not always the funnest. Yeah, but you know, essentially, it's just really me trying to kind of get back to myself because I never belonged to myself. I think that's something we all probably can relate to. That's having gone through childhood abuse or just growing up in a small little village where we weren't allowed to kind of look even slightly divergent. But again, that is always at odds with the fact that society is kind of predicated upon us not surviving and us hiding. So those two things have to be met. You know, we need community care and we need self-care. But yeah, thank you for listening to me ramble.
That wasn't a ramble at all. That was really beautiful and powerful. Thank you for sharing so generously with us. A really large amount of what you said really resonated with me a lot. I love that phrase, violently dislocated from the body. I'm going to remember that for forever. I've written that down. I think that is a phrase that captures something that is so important, and to think about the ways in which finding a different sort of relationship with our body is related to that process of healing from shame. That seems so important and so at the heart of what we need to think about. So thank you so much for bringing all of that into this space. I really appreciate it. I know that you're going to have more wonderful things to say in the Q&A. I really look forward to that, so thank you. And I'm going to move on now to introduce Nim. So Nim Ralph is an activist, freelance writer, trainer and facilitator. They campaign actively for queer and trans rights and organise extensively around issues related to anti-racism, disability and the environment. Nim's incredible facilitation skills are really an example to us all at Make Space, and we were just thrilled that they could be part of this panel. So thank you so much, Nim, and please feel free to start anytime.
Thank you so much. And thank you, Tamara-Jade, Ginny, Raihan. It's been great. Every time one of you speaks, I'm like, oh no, I have to go after you. So when I was sent the questions for this, it got me, I think as all the panelists, it really got me thinking a lot and getting quite introspective. And where I kind of got to thinking, or where I kind of got most clear thoughts first was thinking about healthcare holistically, not just mental health care, but healthcare more broadly for LGBTQ plus people. And the relationship that as kind of LGBTQ plus communities and different communities have with healthcare systems. Because I think unless we understand that, we can't talk about individual services and differences. And in many ways, I think of lots of kind of protected characteristics or marginalized communities. I'm going to shorthand to queer people so I don't have to say the acronym each time, but just to be clear, I'm not trying to erase other identities, but that queer people have historically, or at least in the last few decades, interacted much more with healthcare services than many others by nature of who we are. So whether that's through the HIV and AIDS crisis, whether it's through sexual health services, or as trans people seeking medicalized support through trans experiences. And so in theory, we should be more familiar with, more skilled, more clued up, and more trusting of healthcare services. And yet often we are least trusting of healthcare services. And I was really thinking about that a lot. And I was thinking about as a trans person, my medicalized trans journey, as well as my mental health kind of journey within that, and thinking about the ways that actually nearly everything I know about my own body, whether it's about how to access surgery, whether it has been how to learn how to inject my own hormones, or even to source my own hormones, whether it's been about sexual health practices for my body, or whether it's been about mental health. Nearly all of that I've actually learned in queer people of colour communities that I've managed to build or find around me. And we share that knowledge with each other and share safe practices and pass information on. And in many ways, I think there's a joke sometimes in trans communities that we have to be expert. We have to be like medical professionals and anthropologists and psychologists. Like we have to kind of be all these things, not only to look after each other, but also to defend our very existence to other people. And I think about that when I was thinking about this conversation, and thinking that one of the things that has made that possible is that either consciously building or finding cutie pot communities to find myself in, and I didn't always have that. And it's something I've been acutely aware of through this pandemic, that there's lots and lots of trans people, LGBTQ plus people more broadly alone right now in unsafe environments and not able to access support because they didn't have it before the pandemic. And the internet in many ways should make that more possible. And yet for lots of people, they can't access the internet privately at home. And so that kind of worry of isolation for people has really been on my mind a lot through the pandemic. And then it takes me back to thinking about myself as a teen, or kind of before I hit my early 20s, when I was alone and I was that person, and I did self-harm. Also cutting up everywhere again. You really made me laugh when you said that. And also queer and trans in a home where I couldn't talk about any of it. There was shame around all of it and lots of other things in my life compounding shame, but that there was a kind of a shame of who I was that I was hiding, and then a shame of my coping mechanism that I was hiding. And this kind of confusion, and I think often that self-harming being about dissociation and about coping. So I really appreciated Raihan and Ginny, you both naming kind of dissociation and coping differently in all of this, but that the shame compounded on that was like shame compounding on shame compounding on shame. And then where I found safety was in secrecy. And I think that that's really true for so many LGBTQ people, that secrecy is safety. And so when I think about mental health support and therapies and talking therapies, I think one of the big barriers is not understanding, number one, anybody being able to safely access those services, but two, the relationship between secrecy and safety for many of us, and how those things are bound together and how hard that is to unpick if the point of intervention is the point of accessing a service. So then I think this links then on to also a piece about trauma and those traumas and how they're compounded, which is that something that Tamara-Jade you already spoke to. I feel like before this panel started, I was like, I don't want to go first. And now I'm like, I've got nothing new to say. You all said it all. Something that you said, Tamara-Jade, was about the structures and the LGBTQ plus people. We don't have trauma because we're lesbian or gay or bisexual or trans. We have trauma because of society and the way it treats us for being lesbian or gay or bisexual or trans. And that's about housing, it's about family, it's about employment, it's about justice systems. It's that kind of the whole spectrum of our material realities in the world and how harm is done to us through all those systems. And that locating that trauma and being able to understand and growing up to understand that that trauma isn't located in me, or the reason for the trauma isn't located in me, but is about those systems, has been incredibly freeing and helpful, and taken a lot of unlearning as well as learning. But really what I realized is what's changed fundamentally for me isn't society in that, it's finding other support. That brings me back to, sorry, I scribbled my notes really badly. That brings me back to kind of where do we go with this? Because I saw earlier in the chat, people were saying, but we don't need less services. And I absolutely agree with that. But I think that we do need to understand, where do people find support? And why do communities historically have low trust? And there's lots of headlines at the moment, for example, of so-called BAME communities being resistant to getting the vaccine, which are completely decontextualized from particularly Black communities, but also other communities of color being historically victimized by healthcare systems and used as medical guinea pigs, and had enforced surgeries and things that weren't even communicated before they were done. And so I think until we step back and understand communities and people's relationships in a systemic sense towards services, more services aren't going to help without dealing with the reasons that people can't or won't access the services in the first place. And I think that therefore the solution has to be located in building trust, as well as thinking about community-based services and holistic views of mental health as connected to wider systems. And so bringing that back to a trans experience of mental health, the last thing I wanted to say on that is that as a trans person specifically, my most recent interaction with mental health services was, or my most recent personal, rather than for anybody else, experience of interacting with mental health services was having to get a mental health diagnosis of transsexualism just to access life-saving medication for being trans. And so that pathologization for just being who I am inherently lowers a community's trust in a system that says it's there to help you. And then on top of that, when I have to access any kind of physical service, the binary gender that's ingrained and set up means that it's very, very hard as a trans person, whether you're binary trans or non-binary trans, to access support when you have to go to the women's services to get a smear test when you're a man, and so on and so forth. These are all barriers that put in the way that reinforce each time you interact with them that these services aren't for me. People don't want to look after me and my body.
Thank you so much. That was just a brilliant talk, and it brought together so many different things. And I think I was really struck by your notion of shame on shame on shame. That, oh boy, does that speak to me. That was just really moving, and I think in some ways connects perfectly both with a lot of things I think about in terms of what does it mean to just always to be constantly reinforcing self-harm as something that is shameful. I really worry about that a lot, but also just more generally, it felt like a lot of the things you said brought together this question that when people don't engage with services, it's not because they need a bit of reassurance, it's because they have very, very good, important reasons for not feeling like that engagement is safe, whether that is like layers of like historic and ingrained shame, or whether it's many tangible, terrible experiences of discrimination, or whether it's the like certain feeling that services are not set up in your interest. And I think that it's really important to reframe a sense in which people like aren't reaching out for help or like aren't accessing services, to recognize that like if services aren't safe, then how could people access them? So thank you so much. That was brilliant. I can't wait to hear more in the Q&A, but for the sake of time, I'm going to move on now and introduce Max. So Max Cohen is a counsellor, trainer and group facilitator based in Exeter. He is founder and director of It's All About You Wellbeing for LGBTQ+ communities in Southwest England. He is passionate about giving space to enable queer people to talk about themselves, what affects their well-being, and help them develop resources to live their best lives. It's All About You does really wonderful work, and so we feel very, very lucky that Max is here to share his insights with us. So thank you very much.
Brilliant, thanks so much. It's great to be here. And yeah, Nim, you were saying about going sort of later in the lineup. I'm like, oh shit, what am I going to say now? Anyway, so what I do want to say is that some of what I want to say is about me being a counsellor, and with working with a lot of LGBT+ people within this community, but also myself as a trans man, experiencing self-harm and suicidal ideation. And yeah, I think it's interesting what you were saying, Nim, about people sort of having to there's this conflict really about sort of proving this is for trans plus people, proving gender dysphoria, yet needing to sort of prove that they're stable and have capacity to give informed consent for affirming surgery. So there's a lot of sort of complexity to all of this. So it's really, really complex scenarios really. And yeah, I was thinking about sort of self-harm as in the physicality of it and relationship to trans plus people's bodies really. And not many people necessarily will talk about self-harm in relation to things like extreme binding and extreme tucking. So for those who don't know, binding is binding the chest, and tucking genitals, and how that plays out actually within the meaning of for some trans people. And I think part of what I hope to do and you know, it's great to have this conversation, is about sort of helping people develop their own coping strategies, but it's about sort of what this means to each person as well. So quite a few people that I've spoken to recently who have talked about their self-harm to me as a counsellor, have also talked about wanting to have existential conversations with people and not being able to sort of find a space for those either. And so it's almost like, you know, sort of what's the meaning of life? How can I, when I, you know, transition and emerge to this person that I've always dreamed of being, but is my authentic self as well, you know, yeah, what's my meaning in life? So yeah, I think also talking about the complexities of living with gender dysphoria, it's about with the waiting lists for medical transition, whether that, you know, it's 2 to 3 years, you know, at the moment, and so that puts people in a really limbo place. So it's like living in a place of crisis, needing to appear to be stable and coping with things, but also you're waiting for this really sort of life affirming you know, medical treatment or therapy or whatever it is. So part of this for me is about enabling in expression of emotion, and that could be in any sort of time period. You know, I sort of talked about gender affirming surgery. I think there is, as well as the gender euphoria, you know, after surgery, there is a period of, there's a grief cycle as well. Not many people talk about this. And, you know, for me, having had some surgery, I didn't know that I was going to, you know, feel, you know, a lot of grief after it. So it's about sort of being able to, you know, have ways, safe ways, creative ways of, you know, expressing emotions and during sort of periods of change and loss. Yeah, I think it's interesting. People have yeah, talked about shame and shame on shame on shame, and you know, for me this is a, you know, massive issue. You know, we sort of talk about prides, and I sort of see pride on one end of a spectrum and shame and self-criticism on another sort of, you know, the other part of a spectrum sometimes. And some of the work I'm doing at the moment is around compassionate mindfulness to try to help people move from, you know, a place of shame and self-criticism to a more self-compassionate place. And I think it's about sort of, you know, getting education, obviously, and awareness for healthcare professionals as well, and encouraging people to, you know, expand the narrative around what bodies are, you know. So it's not binary, you know, not a binary thing. It's about body positivity in all its sort of forms. So I think it's about, yeah, education. It's about helping people, yeah, be creative in their expression. Yeah. Yeah, so one of the things I'm doing, I've had in my head this idea for a wellbeing course for trans plus people, and I've had it in my head for ages, and I'm into week 2 of delivering it, and it's really amazing. I had wanted to deliver it in person, but obviously Zoom, yeah, it's great. So I've got a group of people who, you know, didn't know each other, didn't know anyone else. They're sort of isolated, self-isolating as well, and it's proven to be, you know, a really good thing to happen. So yeah, part of it is about compassionate mindfulness, part of it is about looking at identity, body positivity as well within trans plus communities. It's a bit about feel the fear and do it anyway, a bit about assertiveness. So some people talked about queer people being advocates and sort of specialists. So it's all to do with that. So yeah, but thanks for this opportunity to have this discussion, and yeah, let's go for it. It's brilliant.
Oh, well, thank you so much. What a perfect way to finish up the panel presentations. You touched on so many things that other people, that it sort of feels like everybody's given us this perfect like array of different aspects of something that is still really, really connected. So thank you so much. But we'll pick up on a lot of them after the break, but I really wanted to pick up first on what you said about it being important to think about self-harm's meaning and how self-harm might hold a very particular meaning for different people. And that's something that I think it makes space we think about a lot and really, really believe in and believe is important. And then also the way you sort of linked it to the question of things that are impossible to talk about. I think that that's something that resonates with me, this question of the way in which self-harm as an experience can be bound up with things that are impossible to talk about. And then self-harm itself can often feel so impossible to talk about as well. It feels like just an echo of what Nim said, shame on shame and silence on silence. It can be, I think that really brings a lot of that complexity to the forefront. I think there have been a couple of things in the chat that I will try and pick up on and get to. But I guess I wanted to start off by actually like not really responding, but just sort of naming that it felt really powerful and wonderful to hear all of those perspectives. And in particular to hear, as I said, sort of different facets of things that felt like they connected them. So things like thinking about bodies and embodiment, thinking about meaning and selfhood, and thinking about safety and unsafety and how much unsafety affects us like to our very core, and unsafety in all different meanings of the word, and thinking about this connection between the personal and the structural, and the really like important impact that these very huge structural inequalities and cruelties have on people's lives and on their well-being. And I really appreciated that all the panelists did such a wonderful job of touching on all of those things in their own way. And to be able to see those threads running through felt really wonderful. I suppose what I'm asking about is the question of burnout and overburden within LGBTQ+ communities, in which because those are communities in which we invest a lot of care in one another, or we hope to, I'm sure we often fail, that we can feel responsible for stepping in to meet the gaps in services. And that's a really I think we all talked about, well, I didn't talk, everybody talked about the value of communal care and of community organising, but that's also that we in ourselves as queer people are a limited resource, and that it might sometimes feel like there's not enough of us to go around, especially because we're all also holding our own stuff as well. And so I was just wondering if that was something that resonated with the panel, and if you had, in your, I think, great wisdom, some advice for us about how to respond to that or how to think about it. Does that make more sense how I framed that?
My thoughts personally, I mean, this isn't going to be a particularly popular answer because it's not immediate. The only real thing that we can do is abolition. I mean, it's just really, really the only thing we can do, because there is, I mean, it pretty much goes back to what Nim was talking about. It's a perfect example of how we need to be everything to everyone and to ourselves. And for us to even survive, we need to be our own doctors, our own psychologists. We need to advocate for ourselves in rooms with those people who are meant to be taking care of us, defend and protect ourselves from them so we can get what resources we need. What we really need is all the resources to be able to do with it what we want to, because we're better equipped to do so, because we have that kind of the lived experience, the body intelligence, all of these things. But there is only so much we can do, these limited things. But there's a joke, I think there's a joke on like Twitter with a lot of there's a group of trans women who said, trans Twitter is basically all of us sharing around the same $20 over and over again. And it's like, we're, you know, as a community, we're amazing at that. Like, you see that during the AIDS crisis, you see that now. I mean, when you need testosterone, you ask your friend, like, hey, can I, or when you need estrogen, you say, can I get that gel? I was on the estrogen pills, but I need gel right now. You know, we do this stuff for each other, but we can only do so much with that $20. So what we really need is the resources and we don't have a situation where we don't have to contend with these institutions that medicalize your gender experience or gender affirming surgeries and stuff like that. And it kind of also goes back to what I was saying about being ostentatious with your body and body modification, all of these things. I think moving away from a policy and a politic of austerity, wherein it's like, you can't be too loud as a person, you can't be too loud in your family, you can't dress too loud, you can't just ask for tips on the NHS if you want. It's like, well, yeah, you should be able to. Do you know what I mean? We have to move away from that politic of austerity that says you can't do that, that's attention seeking, that's too much, and just demand everything, because it's kind of the only option at this point, you know, and it's a good option, it's a great option.
I could add. Yeah, I think it's a really important question, because I think it's absolutely true, and it deeply resonates with me. The number, I can't tell you the number of times in community that I've been part of a mental health crisis informal support system, and I think it really does. I'm trying to think how to say this articulately. I think what you say about burning ourselves out is absolutely true. I think there are strategies for making it easier as I've got older, and honestly more practiced at it, around things like thinking about rotas, checking in with people and checking in that they're actually able to offer that support, and who is and who isn't, and what each other's boundaries are. Because also, I've been in mental health crisis situations where we're doing overnight suicide watches, and then the person doing the watch gets really triggered because of the situation, because we haven't been able to communicate about that, and things like this. And I think, again, it links back to the structural, because I think there's a reason that, in my experience, communities haven't gone to mental health support, and there is an inherent fear in queer communities, people of colour communities, of sectioning and mental health services. And in the UK, I think, linking it to the point Raihan you made about abolition, it's worth pointing out that most deaths of racialised deaths in state custody happen in mental health services in the UK. And so I think all of these things are connected. And then that connects back to the fact that we are having to be each other's support systems, psychiatrists. We don't have resources. We end up in scarcity mindsets with each other about what's available. We trigger each other. There is trauma. Somebody wrote in the chat earlier something about taking responsibility for your own behavior. And as traumatized people, you know, I'm not going to lie, like, we often harm each other in it's the flip side of the coin. I've learned everything I know about healthcare and community. I've also learned everything I know about trauma and being triggered in community. We can be messy bitches. We hurt each other, and in intimate relationships, when your trauma is situated in intimate relationships, you can, you know, really get in really terrible, harmful trauma loops with each other, trauma bonding, etc. I think all of that is true. And then all of that compounds our ability to access employment and education and safe housing, and so on and so forth. And so you start to see, I think, in that question, how all of these situations are linked structurally. And so, yes, I think I've learned better management of situations as I've got older. And I think what I've seen, what's heartening to me in the last few years, is I've seen more trans and LGBT community projects, not big national organizations with a pot of funding that runs out, establish themselves, who do have resources to really take care. And we do have a lot of that knowledge and experience and expertise in communities. And so I think that that's really important. And I don't think we're going to really solve these problems without solving those structural issues that kind of feed the loop as we go around.
those are really, really helpful responses, and I think sort of form two perfect sides of the same coin, in which there's something really important about putting tangible physical resources into community resources. And that also, I think you're really right, that my question was asked within a scarcity mindset, and that you're right that that doesn't get us very far, that we need to believe in and hope for and work for the huge, big structural abolitionist changes that actually will enable like the sustainability of care. So thank you. But those are both really, really helpful responses. I want to, just in case Max or Ginny or Tamara-Jade had anything to say. Yes, I didn't want to, I'm not like closing the floor or anything.
Oh, now my mind just went blank. Yeah, no, I was thinking about what you were saying about putting more resources into community that know what they're doing, essentially. And then I guess the thing to just name as well, which I'm not going to go into though, is like how so many of us can't get the help that we need because the thing that is harming us is criminalized. And so whether that's a person enacting harm on us, or I don't know, sex work is involved or drugs is involved, there's so many, like such a matrix of like things, which reminds me of what Nim was saying around safety being secrecy, of having to keep potentially other people's secrets as well as your own in order to stay safe. But in terms of the resources part, I was thinking about how quite a lot of activist groups have done some crowdfunding over the pandemic, and suddenly we saw obviously last summer lots of interest in the movement for Black Lives, and suddenly you're seeing injections of cash going to community groups, which is incredible. But I think even before that part where we want to be putting resources into these groups, is I think we should be building the muscle of how in these community groups we communicate with one another. And so I think on the even micro level, I know this sounds silly, but something I've done in the pandemic is I have a morning check-in group with a few of my friends. Every Monday to Friday, we say things, nice affirmations and stuff like that. And I feel like just feeling accountable to another group and saying, yo, I'm going to be here every Monday to Friday, and kind of deepening what that responsibility is, but also making a commitment to trying to be honest. Because like Nim was saying, some of the hardest things like around trauma I've learned from community as well. So I'd love to see these community, like our community organizations getting more money, but in order to manage that money and resources well, I think there's that step of like, we need to be, I think even in my bio, I said, I love talking about conflict, but understanding how we manage conflict. And that's not just talking about other people, like how they manage conflict, but also involves some soul searching around in what ways am I unable to have the conversations that need to be had to get the support that I need. Yeah, I don't know if I've gone completely off tangent, but
no, that's perfect. That's a wonderful response. Really about like, in some ways, the perfect complement, because we want to be doing the huge, big work of abolition, but we can't do it on our own, and we can't do it without one another. So we have to really build that, like the tangible methods of care between us on like quite a micro scale, but that makes such a big difference to the work we're able to do together that we want to commit to doing together. So I think that's perfect. Ginny, Max, I don't want to leave either of you out, but I can ask a different question if you would like me to ask a different question.
Yeah, I mean, I too relate to what you say, and I've been in situations where I've had to withdraw to some extent, and I think maybe many of us have, for fear of being sort of sucked into a worse place through supporting other people, because we're not able to at that time. And I think that's maybe about setting boundaries and being quite clear with yourself about what you can offer, and Lucy in the chat, I actually am in the same situation as you there. And the way that I see it is literally doing what you're doing here, make a space for people, literally make a space and just allow people to express what they need to say in a non-judgmental space. And I think that's one of the most therapeutic things that you can offer anyone, without giving advice, without kind of putting your point of view on them, just making a space that people can feel safe in talking. And just one other point I'd like to make is just when we're talking about the pain, we should not ignore the joy as well, and the fantasticness of the community and some of the wonderful things about life. So I think, you know, we can kind of get a very kind of dwelly on how terrible things are, but, you know, let's not forget there's joyful stuff going on too. So yeah.
No, I think that's a perfect, that's something we've thought about a lot in putting together this series of events, that there's something really important about recognizing how this world is not set up to be caring to or safe for LGBTQ people, but that doesn't mean that there isn't like joy and delight and love to be found in queerness. Like, that's really important. So thank you, that's a perfect point. So I'm keeping half an eye on the time because I know actually we're coming up close to time. And in some ways I think there have been a couple of questions in the chat that I want to maybe bring together of people sort of thinking, and I think it really ties into what we've been already talking about, that there's some really fundamental incompatibilities between the things we feel like we need as a community and as individuals and the things that services are providing or even ever could provide. But I wondered maybe if there was sort of a key piece of advice you might feel or not feel able to give people who are involved in services and in service provision, but also alternatively in like trying to respond with care perhaps to people in a non-professional capacity, like as a family member or a friend. So there's many people in the chat who asked a lot of things, and I'm not asking all of those questions because we're going to run out of time, but I hope that is a good enough paraphrase of them, that people feel like that there's a response here. Did that make sense, members of the panel? Have I asked that question in a way that made sense? Do you have one recommendation for people who are trying to either think about how services could do much better or just how they could respond differently in their own lives?
Yeah, just one from me. I'm trying to get into the counselling colleges, LGBT plus content for starters, so that, you know, counsellors training actually get some really good input, not just one day on, you know, diversity, but, you know, ongoing, you know, case studies, you know. So yeah, that's one of my suggestions anyway.
In terms of like advice for services, I think, I mean, it might seem obvious, but I feel like we've had so much stuff around like we need to talk, make sure, you know, about making space, about talking, as if that in of itself is the key to solving our problems. And I just think in terms of like the big mental health support structures, there just continues to be a complete lack of analysis of the material circumstances of the people they're supporting. And so being able to acknowledge that like racism and queerphobia and borders and all kinds of different systems exist and have direct correlation to experiences of mental health. I literally, just to kind of give, I once had a counsellor who I was seeing for months, and she was a person of colour. And I thought, because she was a person of colour, it would be cool to like just say whatever about racism, because, oh, well, representation. I thought this politics of representation will keep me safe. But then one session she told me, oh, I think you're racist against white people, when I said something completely not provocative at all. Really not. And I just think that it's kind of ingrained to a lot of services to kind of act as if these things are incidental, as opposed to the key source of so much of the issue.
Thank you. I'm very sorry that your therapist said that to you. That is unbelievably unprofessional and unethical and very poor practice.
I explained to her how racism works, and then I got a refund on the session, just saying.
Oh, 10 out of 10. You're my hero. Well done. Excellent and good work. Sorry, I didn't mean to interrupt other people's answers there.
I think in terms of the, sorry, I feel like I forgot your question, but I have an answer to it. But you know the specific question. I think for me, a good solution and an answer and a way of being is embracing irreverence and playfulness. I think that is really, really important in the way kind of care providers interact with patients, the way friends interact with each other, the way we interact with each other on the panel. Because I mean, I know you said earlier you feel like you always interact with people, and I literally just wanted to unmute myself and be like, "Shut up! What are you talking about? You're the best. Like, you're doing great." And you know, those types of things, what it does is it kind of creating that kind of sociality breaks through the, I don't know how to put it. It breaks through the kind of like rigor and the red tape and the bureaucracy and the kind of weird things that keep us separated from each other. But when you approach things with a sense of playfulness and irreverence, and you're able to say like, "No, you're great. Oh my God, this is shit." It can be kind of life-saving, and it kind of brings you closer to intimacy with others and intimacy with yourself. And that's something that I've found to be really powerful as someone who's been in psychotherapy for years and years, and someone who is also kind of a facilitator for other people. I also think it can be really nice for like if you're depressed and you just look around and you're like, "God, fucking hell, like, I'm so..." Like sometimes I'll just do the impression of the Nan from Catherine Tate just because it makes me laugh. And I'll be like, do you know what I mean? Just little things that just kind of a sense of playfulness about life, because we are people who are like suffering deeply. So just having a bit of a laugh about it, I think creates or it dissolves kind of a lot of the tension between us.
That's wonderful. And I have a lot of, that speaks to a lot of the things we think about holding self-harm lightly, rather than, I think, I hear a lot about people talking about we need to take self-harm seriously. And sometimes I think, oh, I think we need to take it a bit more lightly. Like, my gosh. So you've articulated more perfectly than I could have, like a lot of things, I think. So thank you. Ginny and Nim, I'm without making reference to me interrupting, I didn't want to cut either of you off from speaking.
I'm happy to go. Yeah, I think I think we've got a mixed audience, so there's two angles at which I'm thinking of this. I think in terms of services, health organizations, cis or straight allies, I think that a lot of the answer I actually think that there's kind of two very clear steps forward for me for this, which is one that I think sexual health services have done an incredible job in the last 15 years of trying to understand how to reach different communities differently. And I think there's models there that can be used as what's replicable for mental health services in approaches and in community access. And I think the other thing is building up relationship. And I think I talked a lot about the problem being lack of trust, and the salve to that is building trust. It's so simple, but it's true. And in building relationship, we also build understanding. I appreciate the comments in the chat saying I've never heard these conversations before. I know X number of people and they haven't talked to me about this. And so really building trust and relationship is the way that we learn from each other about our experiences. And it also then speaks to the kind of structural issues of lots of grassroots and community-led organizations being unfunded, which is that relationship shouldn't be extractive. Tell me how to reach you because that's doing you a favor. It should be, how do we work in meaningful partnership together, which may be sharing money, it might be sharing workers. Some of the best partnerships I've seen is actually being organisations that end up co-hiring workers together, and there's different things there, but really working together. And I think for people here who are LGBTQ plus, etc., I think actually, Ginny, you kind of said it already, so I'm only really rephrasing what you said, but one of the questions we didn't get to more explicitly was about how to not simplify this to being about pain, but bringing joy in as well. And I do a lot of work, as Tamara-Jade said earlier, in training, facilitation and educating around really difficult concepts in social justice movements with people who experience structural harms, racism, ableism, queerphobia, etc. And I think there's a kind of received wisdom that when you have these conversations, you're only taking them seriously if you're sad. But that, like, actually laughter and joy is not only an emotional release as well, but also is the goal. And so if we kind of, in the means to the ends, only hold ourselves in the trauma and the pain, what are we actually moving towards? And I actually really, I just think there's so much joy to be had. And like, when I can forget about the world, I love being trans. I love it. I love how joyful it is. Like I feel like I also don't want to flatten our experience too much that way, because sometimes it's like we can only be one or the other, and both are true, but like there's trauma and pain and there's joy. But like at the moment, people are recognizing how much joyful they are, that the capitalist world is commodifying us. Like RuPaul's Drag Race is not like a global franchise for no reason. And actually, I think about it like coming back to my own body, and the two main locations of scars I have on my body are my self-harm scars and my top surgery scars. And what I find really interesting about that through my own body is that I'm proud of and love my top surgery scar. And even though they're 20 years old, I'm still struggling with my self-harm ones, and hope people don't notice them. And I think that juxtaposition of like how shame works and where we are allowed to reclaim and where we're not, is one that's really important. Yeah.
Oh, that was wonderful. And I agree. I agree with all of that very, very much. I'm going to pass over quickly to Ginny for the last word before we wrap up.
No, I just agree with everybody. I think that, services should be saying the problem is not you, it's the system. I think the services should be teaching the history of minority groups and like the amazing kind of agitprop actions and resistance those groups have brought together over the years, and even the history of self-harm maybe. Like in some historical contexts, it's considered a valid form of self-expression or art. So, I'm very much on the page with this engendering of irreverence as well. I love that idea, and thinking about the joy that is the aim, let's face it. So and peer support and putting people together. So all those things that people have said already. So yes, engendering irreverence, I like that.
Well, what a wonderful note to finish on. I'm going to pass over to Courtney because I know that we're at time. I want to indulge myself in being able to say thank you to our really wonderful panelists. I feel very, very privileged, and I'm sure the members of our audience do as well, have been able to benefit from your wisdom and your insight this evening. I'm going to be taking what you said with me and thinking about it for a long time. So really thank you. And I'm going to pass over to Courtney, who's going to close things out and do some final housekeeping.
Hi again, everyone. And yeah, I feel really pleased you were able to join us this evening. I suppose I'm thinking about that notion of collective care that people have been talking about, we've been coming back to, and I've been thinking like about feeling really held in community by this evening actually, and like this, this conversation or being kind of participating in this space to me in some ways felt like collective care. Like I've really, self-harm is a journey that I'm also onto, and making sense of my own queerness, and a lot of what's been shared this evening has really like touched a lot of things, and I feel like I've got a lot of insight and healing and solidarity. And obviously, as people have already alluded to, there is so much more work to be done. So I'm sitting with the joy of being with you all this evening. So yeah, as well as the kind of joy of this evening, a lot of stuff has come up, and I really just encourage you to kind of do the practices that you know that support you in feeling grounded and transitioning out of the space. Thank you so much for being with us, and I really hope that we see you around soon.